Hello. Welcome, everyone. Thank you for joining our live broadcast today. I'm going to give it some time for some people to join in. Welcome. Thank you for joining in. I just want to say thank you to our sponsors, Lyft and DoorDash, for sponsoring this episode today on Hack TV. Without you, this episode would not be possible. So thank you so much for sponsoring today. Hack is actually looking for more members. I'm a proud Hack member, and we are working on global initiatives here in the States as well as in Haiti. And so if you join on our website today, hackglobal.org/join, you will be entered into a contest to win free Lyft rides and free meals from DoorDash. And so if you sign up today before 12 p.m., before midnight, you will be entered to win free rides through Lyft and free meals through DoorDash. Now, that's a steal, and all you have to do is sign up. It's a free membership. We're doing a lot of groundwork and helping the community in various ways. And so if you sign up today, on the website, it'll give you a little bit more information, and the team can speak with you about what volunteer opportunities there currently are in Hack. So please sign up today for opportunity to get a free Lyft ride. Now, we know you don't want to get on the bus or the train, so get your free code, sign up today, and you can also get a free meal straight to your door from DoorDash if you sign up tonight before 11:59 p.m., before midnight, today, November 11th. Okay, so thank you again to Lyft and to DoorDash. So we are waiting for a few more people to join before we start. Remember, at any given time, if you do have a question, you can drop it in the chat box, and I, as the moderator, will be answering all questions and giving it over to our phenomenal speakers today. So you can drop your questions in the chat box, and we will be navigating and sorting through the questions. They will be anonymous, and your name will not be shared if you do have a question, right? Excited for tonight. We have two phenomenal speakers tonight, and I will be speaking about them shortly. Just want to make sure we are good. All right, so we are going to go ahead and get started. Again, I would like to thank our sponsors for tonight, Lyft and DoorDash. And remember that if you sign up with Hack tonight, you can get a free Lyft ride to go anywhere, especially for our expectant and nursing mothers. If this, you can use this to go to your next appointment, to run to the grocery store, whatever you need to do. This code is for you. Also, DoorDash has sponsored free meals. So if you sign up tonight at hacglobal.org/join, you will be entered to win these codes. All right. So remember, that has to be done tonight before 11:59 p.m. All right. So thank you for joining Navigating Pregnancy During the Pandemic. I'm excited to be moderating this conversation tonight. I'm really tied to this topic right now because as someone who is planning on building a family, I've been doing a lot of research during the pandemic and trying to figure out, is this a right time and how do I make the right choices for my family? And so I am extremely anchored to this topic because it is a defining moment in any parent's life when you are actually making this decision to bring another life into the world, especially during these unprecedented times. And so tonight, we are going to navigate this topic and some other key factors with two phenomenal women who have spent the last few years really buckling down on Black and Brown maternal health and women's health needs. And so they're going to help us understand some key topics and help us to figure out, what should we do? How do we do it? When do we do it? And what are some important things for us to remember while we're navigating pregnancy during the pandemic? And this is a question and some issues that few key people in my own personal circle have had in the past few months. And as we are going through the everyday changes during the pandemic, it is important for us to really have conversations with experts, with people who can help us navigate and understand what are the best and right choices for you as an individual, because everyone's situation is different. And so tonight, we will be joined by Thamar Innocent, who is a certified holistic health coach, a full spectrum doula, and a wellness content creator. Her passion is deeply rooted in her Haitian culture, which prides itself on caring for women from preconception through their transition into motherhood. And her purpose is to empower women to lead a holistic lifestyle while creating a space filled with support, resources, advocacy, love, and a listening ear. Tama has received her BS in Health Services Administration in New York City, and she lives in Brooklyn with her family. And our other dynamic speaker for tonight is Nerline St. Elme, who is a registered nurse, and she currently works as the Director of Patient Services at Concerned Home Managers for the Elderly in New York City. Nerline has 10 years of nursing experience and over 7 years of experience as a community health nurse. She has supervised and overseen patient care in community health centers, home health care, and other community health settings. One of her favorite aspects of work is caring for young women. She provides women with information about their health and well-being, which allows them to make informed decisions that can positively impact other areas of their life. Nerline is an active member of the American Nurses Association and the Haitian American Nurses Association of Greater New York. Being a part of these prestigious nursing organizations allows her to be up to date on current nursing practices and to give back to the community through service. Nerline is currently pursuing her MSN with FNP, specializing at Chamberlain University College of Nursing. She hopes to become a women's health nurse practitioner, which will allow her to advocate for and empower women through her relationships with them as a provider to improve their health. Now, there's nothing like a good Black FNP. So thank you so much for that, Nerline. And thank you so much, Tama, for being the visionary behind holistic health and doula services for women of color. So we're going to go ahead and get started. My name is Debbie Lewis, and I am a strategist. I'm a proud member of Haitian American Caucus. I'm a junior board member at CAMBA, Church Avenue Merchant Block Association, located here in Brooklyn. And I also share a platform called Building the Best Me. That's a series with a mission to support women of color. And when I'm not organizing or planning events, I actually enjoy traveling and spending time with my family in New York and playing with my puppy, who you may hear once or twice because she's very loud. But hopefully she respects my time tonight. So I am so excited about this topic again, because I love talking about pregnancy. And this was something that scared me for a very long time. And I just wanted to stay away from it in whole, right? And now during the pandemic, I actually opened up to doing more research and talking to people like Tama about, the idea of, building a family and what that looks like. And so in my mind, one of the reasons why I was really scared or disinterested in talking about pregnancy and really navigating through the most important parts of it is because as a Caribbean American, my family often views being pregnant as being sick. So my mother would say, oh, she's pregnant, she's sick, everything is off the table, forget it. For the next 5 years, you got to be home. And that's that. There's no anything added on to that. Your baby is a baby till they're 5. And then even when they're 10, they're still a baby. So you can't travel, you can't breathe, you can't do anything. Just take care of your kid. And so in my head, I'm just like, oh, my life is going to be over, because this is all that, my family thinks of. And this is how they pretty much say, this is pregnancy and this is how we have to be. Shout out to my Haitian mother for ingraining that into my head. But as I began to have conversations with, younger people and, holistic coaches and FNPs and women just like you, I've been able to open my mind up to new possibilities and see, a clearer and a happier picture, because it's not all about being stuck at home, right? So to start the conversation off tonight, I just want to talk about some real basic do's and don'ts that people may have heard of from maybe family or friends. So what are some real basic do's and don'ts? Because I know every pregnancy is different and every, person has a different need. So what are some basic do's and don'ts when you are pregnant? And I can throw this over to Tama. What is like maybe 2 or 3 things that you almost always tell someone, to do or not to do?
I think in the beginning of pregnancy, people aren't excited to be pregnant. Like there's this level of like, I'm scared, or, they're trying to find a provider or whatever the case is. Like, I want people to just be happy. Just be happy that, you're pregnant, whether you were trying to get pregnant a lot. And I think, I don't know why, but a lot of the clients I get weren't really trying to get pregnant, but they are. And they're just like, oh, I'm pregnant. Enjoy it. Take a breath. I know it could be overwhelming in the beginning because you're having all these, your hormones are all over the place. You're having all of these feelings, all of these different things are going on, but you just created a life. So that is something to be excited for. And I think that when people are happy, that kind of takes away some of the stress that comes along with being pregnant. So definitely be happy. 2, I always say, this is like the Haitian culture, like, don't tell anybody, wait till you're out of the first trimester. And I think that puts on a lot of stress on people too. It's like you want to share this goodness, but you were told from the day you were born to not tell people when you get pregnant. And I mean, I get it. There's some truth to it, but you want to get good information. So when the people that you do tell, make sure it's people that not only that you can trust with a secret, I guess, but trust to give you real good information. Not those people that's gonna tell you, don't eat this, don't do this, don't da 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 da. Like, calm down, relax. I'm barely 6 weeks. Like, I just wanted to tell you, be happy for me. So like, find people that are going to just have your back. Maybe they'll give you the number to their OBGYN or their provider or whatever. But really, I wouldn't say don't tell anybody, but just be mindful of who you're telling. Make sure you're taking prenatals. Like, when I think of just getting pregnant, I just want people to take away those first feelings of overwhelm, because it's nothing to be overwhelmed about. You're pregnant, whether you decide to keep it or not. Like, just, it's okay. You got this. You can handle it, and we're gonna get through it, no matter what the outcome is.
I like that. I think those are really good tips. Nerline, do you want to add anything to that before we go into our first full-blown topic?
I'm sure. But no, everything you shared, Tamar, was exactly the same, the things that I was going to say. First thing I was going to say was take the prenatals. That's the first thing, I tell my friends or patients. And be excited. When we're pregnant, I mean, we don't see, or we don't feel that we're pregnant right away. I mean, some women, have morning sickness, or, may have some symptoms. But there are people like myself that did not have any morning sickness at all. And like Debbie, you were saying, like, in our culture, it's like, oh, you're sick, you can't do this, you can't lift, you can't, and most people are waiting on you hand and foot, which is great. But we're still, it's not a disability. And I tell that to my patients, it's not a disability. You can still go to work. You can still, work out if, your provider says that it's okay. Do what you usually do and, be active. It doesn't mean you're going to be laying in bed. Everyone's pregnancy is different. Some women have, high risk pregnancies and may need, under the instruction of their provider, to take it easy. But, everyone's different, and it's very important that you find a provider that you're comfortable with, and I don't know if I'm jumping the gun with, to go into this topic, as far as like, when you're looking for a provider, once you first find out that you're pregnant, do your research, speak to your family and friends, that people that you trust that have been pregnant before, and ask them for, referrals. You can ask your primary care provider for referrals to, OBGYN, nurse midwife, and of course, Google is full of resources. You can go on there and do your research to find out, put in what you're looking for, look up the hospital, that you would like to deliver in, if that's your preference. Look up, if you want a facility that has certain things like the room setting that could be like a home-like environment, or might have a whirlpool tub in there. Look up these things and, to find out where you would like to give birth, if it's in a hospital, and call that hospital, find out, who are the providers there, to get their information, call them up, set up an appointment, to meet them in person. And when you go to meet them in person, have a list of questions that, you want to, that you would like to ask. Ask about their, how many, babies they've delivered, ask about their cesarean history, ask a lot of the questions that are important to you, to each provider, until you find that match. You want to have.
Yeah, absolutely. Google can also send you down the spiral, but right, let's not go there. So, all right. So thank you so much for that, ladies. So those were some just basic things to start out the conversation. So what we really want to talk about right now is prenatal care in Black and Brown communities. So what are some disparities that we may find, or that you have heard of, in Black and Brown communities that are not prevalent in other communities? And I will throw this to Nerline first.
Okay. Well, I've had gotten questions about mostly regarding prenatal care is the types of foods that I should eat. I don't see the medical history of the patient being taken into consideration. Part of the prenatal care. I mean, you should be preparing for pregnancy, just like you're doing, Debbie, before you get pregnant. You should be preparing for your body for it, and find out whatever conditions that you have. Make sure it's under control. And speak to your doctor about that. And I find that that's not in the Black and Brown communities. That's not really addressed. Like if you have a history of asthma, high blood pressure, a thyroid disorder, your medical history, affects how you the outcome of your pregnancy, or can affect you being able to get pregnant.
Tama, have you heard of anything differently or maybe the same?
No, everything Nerline said is right, but I always like to draw a picture for people because they don't understand how disproportionate Black women are when giving birth. So like the fact that we have limited access to fresh foods, right? That puts us at risk because we're supposed to be eating nutritiously. We're supposed to be taking care of our bodies, and we can't do that because we have limited access to fresh food. We're coming in, I used to work at a local area hospital, and Black women are coming in with hypertension. They're coming in with diabetes. They're coming in obese. They're coming in with their medical history and like their family having like thyroid issues and things like that, and it can affect them and they don't know that. Right. Or and how are they treating it? They're treating it with medicine, or they even have trouble with getting insurance, or not being able to get an appointment quickly. A lot of times women have trouble when they first get pregnant with getting an appointment, and they're waiting. Like I remember I waited like a good 6 weeks to get an appointment with the doctor that I wanted. And like, it's like the healthcare system is so messed up, and it hurts us as Black women first. Another way is like when we're about to give birth and they don't listen to Black women.
I'll get to that. Yeah.
Right? They don't listen to us. I always say that I got pregnant. I wish I was myself when I got pregnant that I am now, because I didn't know all of these things. I gave birth 10 years ago, and doulas weren't trendy yet. All of this stuff, just all of this information that we have now, I didn't have. My son is 10 years old now. And one thing is, my doctor didn't tell me so much, and I didn't have, like, God got me through that labor and delivery, and me being scared of hospitals got me through that delivery, nothing else, because they just didn't give you the information that we have now. And women really need to, it's not even hard work anymore. Just try a little bit and you'll get so much information, and we're not getting that information because also there is a lack of access to information for us.
So you were saying something really good. I don't want to lose that before, before you get into you're about to get real good. It's about to get juicy.
I know. I don't want to get there too early.
Before I forget, let's talk about the awkward topic of weight gain and nutrition. That is really big in our communities, in Black and Brown communities. We're used to a way of eating. We're used to a way of living and just doing. And when you're talking about pregnancy, there's things that you should incorporate more of, and there's things that you should incorporate less of. And if you're trying, I do believe there's things that you should be eliminating as well. So can you actually speak to that? And this may be a faux pas, but let's just put it out there. Is there such a thing as a normal weight gain for pregnancy? Because I know that's a really big topic as well. So that's two questions in one, if you can answer that.
Yeah, there is a normal weight gain in pregnancy, but also to each person, your doctor will tell you where you at, where you're where you're at on the spectrum, and if you're getting to the point where maybe you're gaining too much weight. There's the saying that we hear, oh, I'm eating for two, so you need to eat more. No, you're still you're not getting that much food. Everything is going to you. So yes, we have the cravings and the appetite has increased, but we're not really eating for two people. So that needs to really change. And of course, we see in like the movies and in dramatization of the husband running out in the middle of the night to get the pregnant wife the ice cream because she's craving and she's like, I need it. It's good to to indulge in some of the cravings, but you have to control it and not have the ice cream every single night. To be very mindful of that. Yes, the foods you eat are very, very important, and in our culture, there's a lot of, we're used to a certain, like David said, we're used to a certain way of living, and a lot of rice and a lot of carbs. But we as we're learning, and I'm glad that we have this platform. Those of you who are watching, you can make better choices and you can make healthier choices. Yes, indulge here and there, but you still have to make sure you're eating healthy for you and your baby.
Tama, do you want to add anything to that?
Yeah. So
first, let me say this to you guys. Tama is hands down. She's like the drill sergeant. I'm not even gonna.
I just want to eat well. No, okay. So that comes. I'll give you a little story really fast. Like that comes from me. When I was pregnant, I hated junk food. Like food became so important to me for some reason. And it did have to do, like what you're saying, with the cravings and stuff. Like I wanted my food a certain way. Like I got into cooking more and things like that. And I used to watch my best friend eat McDonald's, and I used to be disgusted with her. Like I have not had some McDonald's fries since I gave birth to my son. Like I have not had. So thank you. But I love French fries though. But so yeah. But eating well is really not that hard if we begin with elimination. So like, so a few things I want to address, and I'm trying to like figure out what I want to talk about first, right? So you want to make sure that you take away food that comes in a box. You don't want to be eating that. You don't want to be eating because one, we don't know what it is. We don't know what they put in it. And the sodium, and a lot of women during pregnancy deal with that and the swelling and all of that. So you don't want to add that to your diet. And you want to make sure that you're eating a lot of greens and a variety of greens and a variety of colors of vegetables, because we're making a human, right?
Right.
And if you're making a human, like they need everything that you need. So that's all the proteins, all the minerals, the zincs, the vitamin B complex, the magnesium, they need all of that stuff, and everything we can find in food. Right. If we were a society that ate well, we wouldn't need prenatal vitamins, but we do, right? Girl. So definitely you want to start taking your prenatal vitamins. If you are planning this pregnancy, you want to take prenatal vitamins like a good 6 months to a year before you start start trying to get pregnant. And some women are like, oh, but I didn't do that. But are you taking a multivitamin? It's pretty much the same thing. They just stack on a few extra dollars because it's a prenatal vitamin. Yeah. So after a few differences, it's pretty much the same. So you also want to make sure that your prenatal vitamin has integrity. Like, is that the right word? Like, it's a really good prenatal vitamin too.
Not gummies.
Quality.
Not gummies. Not gummies. I love gummies.
What's up with gummies?
Sugar. That's what's sugar. Every woman of childbearing age should take prenatal vitamins, even if you're not married yet. You should be taking prenatal vitamins because we don't get those vitamins in our regular diet. And like I said, like if we were eating the right foods, we wouldn't need to take prenatal vitamins. That's the first thing your doctor prescribes you. I'm
still on the no gummies. I'm sorry.
I mean, she's the nurse. She's right. But they taste really good. Like I stole some of
they
my
do.
mom's
It's
vitamins.
the gummies for me, guys. I'm just saying.
Listen, for me, as long as you're taking them, fine.
Yeah,
As long as you get what you need to get.
and like with morning sickness, I've come across a lot of women that cannot even handle a prenatal vitamin. So going back to the food, it's important that you're eating right.
Mm-hmm.
And just to touch on the weight gain situation, so I have my qualms about this, right? Because as Black, I'm talking to Black people, I'm talking to Haitian people, these charts were not made for us.
Right.
They were made for white people. Point blank, period. They're based on
Period.
white people, period. So as long as you're gaining weight and your doctor understands, because this is about my son, but and he was like breastfed and formula fed when he was first born, and my doctor used to say he's a little underweight, but he's not underweight. He's just on his own chart. Like he's still moving up, but
Right.
he's on his own like wavelength. I forgot what she called it, like that the baby chart, the weight,
Percentile?
The growth scale.
the growth scale.
Yeah,
So like, but like he was on his own like wavelength. So I think with pregnancy and like if you're still gaining weight, you're okay. I'm not going to tell you that you should gain 30 pounds. I'm not going to tell you that you should only gain 60 pounds or whatever it is, but you should be gaining something, because your body by like the first month of pregnancy, you've doubled, not doubled, but I think like by 50%, your blood volume goes up, the baby is growing. So there's reasons for the weight gain. So it's important, but it's not the end all be all.
Right.
It's not.
So I have a few things I just want to recap, but before I do that, there's a question. And the question reads, apart from the sugar, why not gummies?
Oh, for me, that's just my preference. With the gummies, because a lot of the gummies, is because of the sugar. Aside from that, that's why I said to you, listen, if that's what you want to take, go ahead, as long as you're getting those vitamins. So yeah, as long as you're getting the vitamins, go ahead. I mean, I have patients and I have friends that's what they're taking. It's just my personal preference because of the sugar content.
Got it. Okay. So just to recap, y'all gave us some good stuff just now. So just to recap, we spoke about pre-pregnancy and nutrition.
Mm-hmm.
So the things you should do pre-pregnancy and in early stages, taking prenatal vitamins, making sure you're having the right nutrients and the right food. Tama mentioned the right amount of greens and a variety of them, and removing or eliminating a lot of boxed or prepackaged foods. Right? Mm-hmm. So those were some really good pointers. And I also want to throw in there exercise, because I feel like a lot of women, they'll exercise before, but when they're pregnant, they're like, I got to stop working out. You actually need to keep moving. Do you guys agree with that?
No, I agree with that. You need to keep moving. You should definitely stay active. When you get pregnant. I mean, if it's, don't do exercises that are strenuous, but you definitely need to, remain active and not just, just sit around and not do things, but you definitely